Good morning, everybody. Yesterday in New South Wales, we had just over 107,000 people get vaccinated, which is a great outcome. However, we are seeing that rate slightly decline, and we really need to call upon anybody who hasn't had any doses to come forward and get their first dose, but also to make sure that you come forward for your second dose as soon as you can as well. That's really, really important for us to keep the pace that we've managed to have in the last few weeks. I also wanted to highlight that whilst we have more than 42.5% of our population fully vaccinated, we have some time to get to that magic 70% double vaccination when we can look forward to life being much freer than what it is today. To 8 p.m. last night, we had 1,405 cases of community transmission in New South Wales, and tragically 6 people lost their lives, and we extend our deepest condolences to their loved ones who are experiencing obvious grief at this time. I want to stress that whilst today the New South Wales Government is outlining our plan, our roadmap for the way forward in New South Wales, that we're definitely not out of the woods. We know that case numbers are likely to peak in the next week or so, and we also know that our hospital system will be under the greatest stress in October. However, we also know that living with COVID means you have a cautious and staged reopening once you get to those high rates of vaccination in your adult population. Now, we have obviously consulted the national plan. We've also had input from our health experts and stakeholders to make sure that when we start reopening at 70% double dose, that it's done in a safe way and it's only for people who are vaccinated. So you have been warned. If you're not vaccinated, come forward and get the vaccine. Otherwise, you won't be able to participate in the many freedoms that people have at 70% vaccination. I also want to stress that at this stage, the roadmap says that any person who is 70% double dose vaccinated is able to participate in the freedoms that come forward from that time. However, at any stage, and this is consistent with the Doherty report, at any stage, if there's a concentration of disease in a town or a suburb or a local government area or an outbreak that wasn't anticipated, health can restrict movement and give advice to make sure we don't have a surge which is going to put too much pressure on our hospital system. Because even when you have 70% double dose vaccination, there is still a proportion of the community that aren't vaccinated. That's why we're really pushing hard to have as many people as possible come forward for their first dose. Because when you have a high rate of people who've had their first dose, it gives you that extra layer of protection. So we're hopeful. Dr. Chen and I often say we'd love to see the number at 85% or higher for first doses when we get to that 70% double dose figure. And of course, before that time, there'll also be vaccine available for 12 to 15-year-olds, which currently isn't available widely. So there's a number of positive things regarding vaccination that will happen between now and that 70% time. But also to say that an example of how health might give their advice, if at the time we open there are high case numbers in a concentrated area, it may well be that vaccinated people will be able to undertake everything on the list but within their own local community rather than having the freedom to travel everywhere. So everybody at 70% double dose will have freedoms, but at any point if there's an outbreak or a surge or an unexpected thing that arises, health at any time will give government advice to say people in a particular area, a particular town, may need to restrict their movements if they're vaccinated within their area, within their local government area, as opposed to going all over the state. And of course, the closer we get to that time, the closer we'll be able to provide advice based on what health says, gives us as well. I also want to stress that obviously at 80% double dose there'll be further freedoms, including the prospect of international travel, including other things we can do. So what you see before you, the roadmap, is at 70% double dose, and at 80% there'll be more. I also want to stress that there isn't a specific date. We will get to 70% double dose when people get their second dose, when people come forward to get vaccinated, and these freedoms will come into place the Monday after that occurs. So we don't want to put a specific date on that. It's really up to how quickly people get vaccinated and how many people come forward for that vaccine. But the freedoms will trigger on the Monday after that 70%. Now, in relation to schools, we always had to choose a fixed date because unlike other venues and unlike adult activity, it's really important for school communities, for students and teachers to have a fixed date they open to provide absolute certainty, and that's why we nominated the 25th of October. We assumed, and I think that assumption will bear fruit, that by that stage 70% of adults would be vaccinated and there'd be some start of vaccination for 12 to 15-year-olds. And I just wanted to make that point. That's why that 25th of October date is fixed, because we need to provide that certainty and that planning for school communities across the state. But obviously for adults, we have the capacity to be more flexible and make sure that that date of starting the reopening isn't triggered until there's 70% double dose vaccination. But I do want to stress that this roadmap is conditional upon the things that I talked about. If there's high rates of disease in a particular locality or a sudden surge or an outbreak, the Doherty report says you have to restrict movement in those communities. It doesn't mean you can't still go and do the things you want to do, but your mobility will be restricted within a particular distance. And that could happen at any stage, because towns or cities outside of Greater Sydney even who haven't had any outbreaks and experience an outbreak may have to come under that condition, and I just want to make that very clear. Also today the New South Wales Government is announcing that parts of regional New South Wales will be coming out of lockdown, and the Deputy Premier will go into further detail to outline what that means and which parts of the community will be out of lockdown. But obviously those parts of the New South Wales that come out of lockdown on Saturday will still have restrictions placed on them to make sure we limit the spread of disease in our regional communities. And then after Dr Chan's update and Deputy Premier's update on the regions, the Treasurer will make some comments on what this means for New South Wales in terms of our citizens and our businesses, and then we'll take your questions. Thank you.
New South Wales recorded 1,405 locally acquired cases of COVID in the 24-hour period, 2 overseas cases, and we had 156,481 tests. So thank you to all of those people who presented for testing, but also those involved in taking those swabs and undertaking that testing. We currently have 202 cases in ICU, and they span the age range. But a key feature is the predominance of people in ICU who are not vaccinated. So as our ICU and our emergency department colleagues have mentioned at previous press conferences, please come forward, get vaccinated. We do not want to see you or your loved ones in ICU. In terms of deaths, tragically we've had 5 deaths, and I want to express my condolences to the families. We've got a gentleman in his 80s from northwestern Sydney, died at Nepean Hospital, and he was a resident of the aged care facility in Penrith. This was the first death associated with this outbreak. He had received 2 doses of the COVID vaccine but had serious underlying health conditions. There was a woman in her 70s from Western Sydney, died at Ryde Hospital. She was not vaccinated and also had serious underlying health conditions. A woman in her 70s from Western Sydney died at Concord. She was not vaccinated and also had underlying health conditions. A man in his 80s from Sydney Local Health District died at Westmead Hospital. Again, this gentleman was not vaccinated and had serious underlying health conditions. And a woman in her 40s from southwestern Sydney died at Liverpool Hospital. Again, she was not vaccinated and had serious underlying health conditions. In terms of the risk, we are seeing the case numbers continue in those areas that we've previously talked about. So that Cumberland LGA, that Canterbury Bankstown LGA, Liverpool LGAs. But what we're also seeing is the fact that we're seeing an upswing in cases in the inner west, Glebe, Waterloo, and so just want to and Matraville, just to call out to the communities in those areas. You may not have perceived yourself at risk, so please get tested if you have the most minimal of symptoms, but also book your appointment for vaccine. Over the coming weeks, the supply to general practice is increasing as the Commonwealth have procured and brought forward doses of vaccine. Please ensure that you continually check and get an appointment and get vaccinated as soon as possible. In terms of Central Coast and Wollongong, we are seeing an increase of cases in those 2 areas, and again a big call out to our Wollongong and Shell Harbour communities. Please get tested, but also take the opportunity to get vaccinated and also our Central Coast residents, please be very vigilant and also take up any opportunity to get vaccinated. Thank you.
Well, good morning. I start by offering my sincerest condolences to those families who lost loved ones overnight, and you remain in our thoughts and prayers. Today, of course, we have launched the roadmap for 70% double vaccination for this state, for the people of New South Wales, and hopefully it gives a level of hope and light at the end of this tunnel, the long winter, and gives us an opportunity to come together and know that it is worth fighting for. It's important that we stick to the course of being vaccinated and being vigilant following, of course, the lockdown and the stay-home orders that are in place today, because only together are we able to achieve the end result, and that is a level of freedoms. But for regional rural New South Wales today, vast amounts of the regions will open. Mid-North Coast to the North Coast to the Northwest, Albury to Riverina and Murrumbidgee areas, but parts of regional New South Wales won't open. The southern part, southeast, the Illawarra, Shoalhaven area, the Hunter region, Central Coast, out to the Central West, parts of the Far West won't open today, and that's based on the work that we've done with health, looking at parameters around how you can lift restrictions and open up the regions. It's based on active cases in the community, and we know with, of course, COVID, the way it's contagious and transmissible, we've got to have a level of protection for regional rural New South Wales. For those areas that are coming out of lockdown, that you are not coming back to a pre-lockdown environment, there will be capacity limits for our hotels, cafes and restaurants, including the 4 square metre rule, mask wearing, social distancing. There's rules around certain activities that won't recommence. Community sport won't be permitted. But the opportunity to get back to retail shopping, back to work, back to enjoying time with family and friends. It is still a restricted environment because we know through sewage surveillance and our surveillance there is seeding across the regions, and there is a risk that the COVID pandemic continues in regional rural New South Wales. And I need to make this absolutely clear. For all those communities that are coming out of lockdown today, it is a nice feeling, but if there is an active case in your community, you will go back into lockdown for a minimum of 14 days. And that is the commitment that we've made to health, that it is important that we protect communities. One case is one case too many in the regions. It's no different to how we started this in the regions. When Orange had its first case, we went into lockdown. When Armidale had its first case, we went into lockdown. So we'll apply the same logic. Our sewage surveillance does give us an opportunity to almost foreshadow what is occurring, and there are a couple of local government areas today that we're keeping an eye on. Even though you may come out of lockdown today, it's possible before even Saturday you could go back into lockdown. So again, I just want to be upfront with the people of regional rural New South Wales. We're trying to find the balance, trying to do the right thing, but we're hoping, fingers crossed, that this level of opening up in parts of regional rural New South Wales will give us an ability to get back to a level of normal. Getting vaccinated is still the key. Being vaccinated is the key for the long-term success of never going back into lockdown. And to those communities in regional rural New South Wales, just because we're opening today, please, please don't take your foot off the accelerator in relation to getting vaccinated. I know the people of Orange, for instance, the last couple of days have had walk-in clinics. They've come forward and they've been vaccinated. Yesterday, the walk-in clinic was overwhelmed. We had to actually start turning people away, and that's great news in a way, and in Bathurst the same, that the people of regional rural New South Wales understand that the ultimate passport to freedom is actually vaccination. I don't want this opening of the regions today, in parts of the regions, to slow down our vaccination rates, because long term, as we follow the roadmap for New South Wales, there will be a moment in time where vaccinated people will have further freedoms, and that I want to make sure regional and rural New South Wales has the same freedom. So again, today it is a bittersweet day for the regions, where some areas will open up to a restricted environment, other areas won't, and we'll be working with those communities to make sure vaccination rates go up. Overnight, of course, this explains why certain areas continue to be in lockdown. In the Western New South Wales Local Health District, there were 24 new cases overnight, 15 in Dubbo, 4 in Walgett, 2 in Bathurst, 2 in Narromine and 1 in Orange. In the Illawarra, Shoalhaven region, 23 cases. 10 cases were in the Wollongong LGA, 12 cases in Shell Harbour and 1 case in the Shoalhaven. In the Far West, 4 cases, 2 in Broken Hill and 2 in Wilcannia. The Hunter region, 12 new cases overnight, 4 in Port Stephens, 4 in Newcastle, 3 in Lake Macquarie, 1 in Maitland. On the Central Coast, on the Central Coast, there were 22 cases overnight. And again, it is concerning what's happening on the Central Coast. And we're asking people on the Central Coast to remain vigilant in what they are doing, to come forward and get tested, limit mobility, and again, make sure you get vaccinated. Southern New South Wales, there were 3 new cases overnight. There were cases that we flagged yesterday, 2 in Bateman's Bay, 1 in Cooma. But since 8 p.m. last night, we've now been given notice of 2 new cases, and both in Merimbula. That's why in the southeast of the state, in an electorate like Bega, we continue to have those stay-home orders. Again, my call out to the community is to continue to get vaccinated. In the regions we are no different. If we're going to beat the pandemic, if we're going to get back to a level of normal and no longer be locked down in the future, vaccination is our passport.
Thanks, Barra. Well, in many ways it's been the worst of times, but the best of times are on the way. And today's announcement shows the pathway back to our future prosperity here in New South Wales. It's been a difficult winter, but it's going to be an incredibly bright summer, and that is on the back of those high vaccination rates that the Premier, the Deputy Premier have spoken to. That is our key to our future prosperity, and the effort that people right across New South Wales have made has ensured that we've been able to release this roadmap today, which will open up New South Wales. Yes, it will be in a staged way, but it will provide businesses and workers and families right across the state the confidence to know that there is a bright future ahead. And I know it can be difficult when we look overseas and see the activity and the fact that there are greater freedoms in certain countries around the world, but it should also fill us with hope that that is the pathway that New South Wales is on. Just earlier today, the Premier and myself attended a forum with community leaders and business leaders in Western Sydney and Southwest Sydney, and the optimism is there, the hope is there. We know it has been a very, very tough period of time. Many businesses have had to close, many people out of work, but we will get through this. And I think if you look at, the Deputy Premier spoke about past performance. Well, last year, the New South Wales economy went through a very difficult time. Many people lost work. But we recovered every single job. We came out of last year stronger than ever. We're currently working on a recovery plan, an economic recovery plan here for New South Wales, which we will announce in early October, prior to the opening up of the roadmap which we're announcing today. And that recovery will ensure that we don't just bounce back, but we come back stronger than ever before. And that's what we achieved in the past. That's what we will achieve in the future, and I think the roadmap today and the work that the health team and the Deputy Premier has done alongside the Premier in leading this work will ensure that New South Wales is stronger as we move forward. Yes, it's still a difficult time. The financial support is still available to businesses through Service New South Wales. Yet I accept and acknowledge that there were challenges early on. It's very pleasing to see. I want to thank Service New South Wales for the work that they have done in terms of processing a number of these payments. They are obviously ongoing at the moment alongside the disaster payment through Service Australia for workers who have had their hours reduced. So that funding is there. We've always said we'll put workers, we'll put families, we'll put businesses before the budget. It's exactly what we're doing. This is a partnership. We want every single business and worker to get through this difficult time. And if you look at last year, we achieved that, and together as a state we'll achieve that again. Thanks.
These are all coming the first Monday after the vaccination program. If we get 70% double dose on Wednesday or Thursday, why are you counting on the weekend?
Well, there obviously needs to be time, and what we want to do is provide certainty to businesses. And as we approach that date, more will be said. I mean, we're looking at obviously a date in October. That's where the trajectory is. But from the health perspective, and Dr. Chant may comment on this further, but from the health perspective, it's important that there's a period of time and space there as we open up. I think what we do want to get to, as the Premier said, we don't want to announce that date today, but we want to give that certainty to businesses, and I think businesses can now plan for what that reopening looks like. We want to provide that certainty, and whether we get to 70% and then down the track at 80%, I think for the first time businesses right across the state will be able to look at those numbers, get a sense. It's too early to provide a specific date, but obviously we want to make sure we open up in a safe way, and I think we've balanced the health and economic concerns here well, to ensure that businesses can open with confidence.
Treasurer, are we guaranteeing that the 12 LGAs will also, the 12 LGAs of concern, we're guaranteeing that the 12 LGAs of concern will get the same freedoms that the rest of the state gets?
Because what we've said, and as the Premier's pointed out, which is in the National Plan and in the Doherty report, that there may be times as we move forward where there are high case numbers that there would be targeted restrictions in place. But this is a statewide roadmap. This is for everyone right across New South Wales, wherever you work, wherever you live. That this is the plan to take us forward as we move through the year.
The payroll's already asking why we've been able to provide a fixed date for schools but not a fixed date for businesses.
Well, obviously the government's focus early on is to make sure that we get kids back in the classrooms. That's been that provides certainty for parents. That provides.
It's difficult to wind up a cafe, though, for example, with 24 hours notice. So, can you give certainty that you'll give them a fortnight out, or like?
No, we will provide a date, but as we move closer to the 70%, we provided that date for schools. But in relation to businesses, I believe, and the government takes the view that this announcement today provides the certainty, instills confidence in businesses and families right across the state of what the future looks like. As we get closer to the 70%, we'll provide a date, but this provides the direction. It's the first roadmap in the country. New South Wales is leading the way.
Dr. Payroll subsidies that you've got in place for businesses, will they wind up when we hit 70%, or will you keep them rolling because they're obviously still restricted?
Yeah. Well, we're very conscious of the fact that as we ease restrictions, that many businesses will still have impediments to their work, and we will be providing support and reflecting on that. We just recently waived payroll tax for this financial quarter for all businesses with a payroll of less than $10 million, and that will provide extra cash flow for those businesses. We've also deferred all payroll tax liabilities for this quarter as well. So those remain in place. In addition to that, the JobSaver program remains in place, which is the joint federal-state funding arrangement for businesses for as long as hotspot declarations are made, and that's obviously with the federal government. I'm in regular discussions with Josh Frydenberg in relation to the continuation of that support. And as you will see from the roadmap, there will be some businesses that will be opening. And there are others that will still obviously have substantial restrictions in place. And we want to make sure, as we've done through last year and this year, that the financial support is there to get every business through this, and we'll always tailor our packages. And the final point I make is we're currently working on the recovery package at the moment, and that will cover ground and take into consideration where the roadmap is at and where businesses are at right now.
Why will weddings be limited to just 50 people when pubs will be fully open, subject to 1 per 4 square metres rule? Can you explain?
Well, I mean, the health team can provide advice in relation to that, but obviously it has been said in relation to funerals and weddings that they are specific events, and that's very much in line with restrictions that we had last year. We wanted to achieve as much consistency as we could, and I think if you look through that roadmap, in my view, it's more consistent than we were last year, and I think we've learned from some of the issues last year, and I think it's worked out pretty well.
Which one?
The last one, then I'll...
Should businesses assume that the restrictions that are contained in this 70% plan, most of those will fade away once we hit 80%? Should they assume that it'll be opening up from that point?
This is our plan for 70%. We are announcing the plan today, which gives confidence to businesses, to workers right across the state, of what the world looks like at 70%. That's what we are committed to. Obviously, as we move forward, and the government is always considering the health advice in making determinations, and we'll have more to say at a later date around 80%. But this is our plan for 70%. I think it is a well thought through plan. I want to thank the health team, but it should, and I believe it will, give confidence to businesses right across the state that they can start to open up, they can start to stock up and get ready for what is going to be a very bright summer here in New South Wales.
Premier, can we clarify how some of the vaccination
So we'll go to Dr. Jefferson.
Can we clarify how some of the vaccination rules will work? Can we clarify how some of the vaccination rules will work? Obviously, children 12 and above now qualify for the vaccine. Does that mean they have to be vaccinated, or are there provisions?
No, just to be very clear, the Doherty report, which all the states signed up to, has this reopening commencing at adult vaccination rates, and they define that as 16 and over. It covers obviously 16 to 18-year-olds. So that is the plan that all of us signed up to as chief ministers and premiers, and that's the plan that New South Wales is sticking to. Now, it's important to note that we will hit, in all likelihood, 70% double dose ahead of other states. So I don't expect other states to open their borders to us at that time, because other states will be catching up to get their vaccination rates at 70% double dose, because the plan says that the nation has to reach that amount before any consideration is given to internal borders. But I have every confidence that by the time New South Wales gets to 80% double dose, and I don't think too many states will be too far behind, that we will then at that stage not have any internal borders in Australia, and that our eye will be towards international travel as well. And I want to make that point very clear. So I don't want anyone to think that all the states are going to open their borders to us at 70% double dose. Far from it. We'll get there before other states do. That means we can relieve the pressure on our citizens because we've maintained those vaccination rates. But as Dr. Chan, and Minister Hazzard and I say all the time, the higher number of people who've got a first dose by that time will make it safer for everybody. Because by the time that we get to 70% double dose, if we have around 80 or 85% of people who've already had their first dose, that gives everybody an extra layer of protection. Plus, on top of that, if we have a substantial number of 12 to 15-year-olds who are also vaccinated, that again gives us cover. So the key for us is to always keep an eye on what's happening in our intensive care wards, and today you'll find for the first time we went over 200 in the number of people in our intensive care wards. We know the system will come under the most pressure in October. We have to keep an eye on that, but we also have to keep an eye on our vaccination rates, and that's why it's really important. There are parts of our state where the average is clearly below 70. And there are parts of Greater Sydney where the average is below 70. And we need everybody to catch up so those communities aren't vulnerable. Then you'll have pockets of community who are extremely vulnerable. Even if they don't attend those events, the virus will still be circulating. And if you're not vaccinated, you could end up in intensive care, which is the last thing we want.
So it says that you will be allowed 5 visitors to the home as long as people are vaccinated, but it also says here that non-vaccinated young people under the age of 16 will be able to access all outdoor settings, but will only be able to visit indoor venues with members of their household. So does that mean that any parents with young kids will not be able to visit?
No, quite the opposite. What we're saying is, obviously, at that stage, children will be able to accompany their vaccinated parents at those venues.
What about a family with 2 vaccinated adults with kids aged 12 to 16 who are unvaccinated? Because the 5 visitors says
this doesn't include those age groups yet, because obviously our targets are around adult vaccination. However, we will, once vaccine is available, and I understand as early as next week or the week after, vaccination bookings will open to 12 to 15-year-olds. So the rates of vaccination, our targets, according to the research in Doherty, is for the adult population, and that's defined as 16 and over.
Specifically, a family with kids aged 15 who don't have a vaccine, they can welcome 5 guests to their house?
I'm sorry?
2 parents with kids, with a child, for example, aged 15 who doesn't have a vaccination, can they have 5 guests?
So long as all the adults, so long as everyone 16 and over is vaccinated, that's okay. But the key measure for us, the key benchmark, which the Doherty report says, is 16 and over, and that's why we've kept it consistent. But it's an absolute bonus if we get first dose rates higher than that, and that's why every day we look at those numbers, and currently they're around 75. Hopefully by today we'll kick over to around 76.5% of our adult population will have first dose. But the closer we get that to 80 or 85 or even 90 in some communities, for example, it gives us great relief that in the local government areas of concern, some communities are edging towards 90% of adults at first dose. Now that is outstanding. It means the prospect of them having the same ability to move around the state as others remains very high. And that's why it's really important for us to make sure that we get the first doses up as much as possible to give everybody that extra cushion, as well as the prospect that 12 to 15-year-olds will also have access to the vaccine.
What's the
calling on the thousands of people who've actually been infected with COVID. They obviously can't get the vaccine yet, so will they be given a medal?
Well, we've said vaccination rates and medical exemptions, and when Dr. Chant comes to the mic, I'll get her to answer that question. But essentially, it's these freedoms only exist to anybody who's fully vaccinated, but also who's received a medical exemption.
How will you implement these measures? For example, how will you police that gatherings gatherings in the home with only unvaccinated people, and also the retail can only open to, unvaccinated people will only be able to access critical retail? How's that going to be policed?
Well, it's really easy to police, much easier to police venues, because all retail outlets and other places of hospitality require QR codes. And that is why we have been speaking about the vaccine passport and the QR code system, so that if you want to go and buy something which is regarded as a non-essential shop, you will put up your QR code to the code, and it will, if it's not a green light saying you've been vaccinated, you won't be welcomed inside. So we're giving venues plenty of notice and businesses plenty of notice. They can prepare for what that looks like when we reopen. And obviously there are still some other issues we're working through. For example, if there are opportunities for us for mental health and other purposes to look at other things that we can ease before then, well, based on the health advice, we will do that. This is really for double dose vaccinated people who can enjoy those what we call regulated facilities, places where you can police that it's only vaccinated people going indoors, or going into a venue, or else to an event. Or to other gathering, it is much easier to police those places where the QR codes have to be used.
What about homes?
Well,
is
obviously,
that just an honest system?
Well, obviously, there is no perfection to this, but it would be extremely careless and reckless if anybody welcomes someone if you're vaccinated. I mean, I myself would not want to be anywhere with someone who's not vaccinated. That's just my personal choice. And people will make those personal choices. Some people who are fully vaccinated may not even feel comfortable participating in things at this level. I really want to stress the point that this is what government is implementing as a safe way that we can reopen. But many people may still not feel safe at that stage, knowing that there's still a high rate of unvaccinated adults, or not a high rate, but a certain percentage. So it also comes down to personal choices, personal actions and activities. And in some venues, obviously, we want people to make sure they maintain social distancing. They don't let their guard down. But we know in reality, people will slip. And that's why we can't afford to have unvaccinated people mixing with vaccinated people. We have to be real about this. People aren't perfect 100% of the time. Even though that's our intention, people try. But everybody slips from time to time unintentionally, and that is where the risk of transmission increases. So we're not suggesting case numbers are going to go down at all during this period. When you reopen, you expect an increase in case numbers. But if it's in the vaccinated population, our health system won't be troubled by that. But if it's in the unvaccinated population, that's when health will give us advice to ease back and perhaps require people to go out, eat out locally, as opposed to having the freedom to move around the state. I'll go around to everyone, yeah.
Aged care visits for people who have both vaccinations, is that on the card?
Yeah, Health has recommended, and it should be in the documents, that they'll be allowed up to 2 visitors in those health facilities for everyone to be vaccinated. It's not just in aged care, it's other hospital settings as well. So Health has actually put forward that recommendation already. But at any time, I want to also make this point clear. I was very clear on the qualifications about outbreaks or high numbers of case numbers in particular areas. But also we have to accept, especially between 70% and 80%, that at any given time, and it's in the interest of the business venue or the facility not to have an outbreak, because people will see things shut down temporarily if health advises there's a risk or there's been an outbreak. As we've seen now, venues are temporarily closed, cleaned out and then reopened. So we will experience that, and we don't want to sugarcoat that. But that's why it's in the business's interest to prevent that from happening, to make sure they don't allow people coming in who aren't vaccinated, because that will impact their business continuity. And we know that what is most important, as the Treasurer will attest, is businesses do not want to be in the pattern of closing and opening and closing and opening. Once they open their doors, they want to be confident they can keep their doors open. And that's why it's really important for everybody to follow this plan. That's why we're giving plenty of notice to the community without knowing exactly how many case numbers we'll have at that point. because the high vaccination rates give us that level of confidence, as does the fact that we're inching towards the late 70s on first doses already, which gives us confidence, hopefully, that within early next week we might even hit 80% first dose. So by the time that date in October comes forward with 70% double dose, we would love to see first doses towards 90%, but also a large chunk of 12 to 15-year-olds vaccinated, because all of that gives us that extra buffer, and it then allows us to consider what 80% might look like, and that's why we're doing the work.
Can I just ask you, it doesn't specifically say we can move around the city. We won't be confined to LGAs anymore.
No, unless,
Just one other thing.
Yeah.
What will be the trigger for areas being shut down again?
Sure. Well, I'll let Dr. Chan answer that question when she comes to the microphone, but just to be clear, at the moment, if you are 70% vaccinated, assuming all other things being equal and there's no major outbreaks or very high case numbers in a particular area, 70% vaccination allows you to move around anywhere in the state, so long as where you go, everybody else is vaccinated. But we cannot afford to have that continue if there's a major outbreak in a particular area. If there's a rural town that suddenly has an outbreak of cases, we will say to people, don't go to that town, and everybody in that town shouldn't leave their town, but they can do what they're allowed to do with 70% double dose in that town. Similarly, it might be a part of Greater Sydney. It may be an LGA, it could be a suburb, or it could be a couple of LGAs. If there's high numbers of cases and a concern about an outbreak, and the vaccination rates aren't as comfortable at a level that we'd like, Dr. Chant is at liberty to say to the government, people in this community, even if they're 70% double vaccinated, they can go to the hairdresser and they can do this and that, but they might be limited only to a radius outside their home or within that area. Now, these are safeguards which the Doherty paper has put in place. These are safeguards which we're following as part of the national plan, and when you're done with me and Dr. Chant comes to the microphone, she'll be able to explain this from a health perspective.
Premier, will curfews go before October? There's no mention of curfews?
No, this is the reason. What we've addressed now are those freedoms fully vaccinated people will have at 70% double dose. But it could very well be the case that before then, the health advice might suggest to us that the trajectory is what we're expecting, so therefore we can ease off on other restrictions which are more related to health and wellbeing as opposed to these venues. So I do not want to rule out that at any stage, if Dr. Chan or a member of her team give government advice to say, well, Premier, the case numbers are actually following the trajectory we thought they would, so we have confidence now that we can ease up here or there. That is still very much an open question, and if a local government area of concern stabilises and reduces case numbers, they can easily not become a local government area of concern, and I would anticipate that a number of them won't be at that level in 6 or 7 weeks' time. So what this document tells you today, the roadmap tells you what we can do at 70% double dose, but there could be other measures which will be eased before then if things go the way we think they will. But as you know, it's very rare to have modelling be perfect.
Sorry, Premier, specifically curfews though, are there any plans to lift curfews at this stage?
Well, that will be based on the health advice. So whilst I just want to be very clear on that, at any stage, Dr. Chant might give government advice to say, we think we're over the worst of it, but I'm sure she'd say today that given we think case numbers are likely to peak next week, she'd want everything to be in place until we get over the hump.
Dr. Chen, you're comfortable with the pubs and gyms opening at a 70% mark? That you're comfortable with that?
Look, as I said, I think the roadmap gives certainty to businesses about what it looks like. I think the Premier's been very clear that this is all contingent on us getting case numbers down and getting control, and that we can have the opportunity to actually do things locally that may respond to outbreaks. So this is not... we would expect that we are seeing case numbers decline at a certain point. That's what the modelling suggests, but that requires everyone to follow the stay-at-home rules and to get vaccinated. And the more vaccine we have in arms, the quicker we will see that decline, and the more people obeying the public health orders, the quicker that decline. Now, obviously, very pleased to give some certainty to the community, but I think that what the Premier has clearly said is if there are local outbreaks, local circumstances, There will be public health measures we may recommend based on our understanding of the circumstances of how transmission's occurring. They will be tailored to those settings. So they may not be geographical, they may be other strategies. So that is open to us to provide those recommendations.
That based on health advice, if cases are too high in a designated area, then this roadmap won't proceed in that certain area. Can you give me an indication of what you will consider as too high? I think especially people in Canterbury Bankstown will want to know, how low do their cases have to go if that area comes up?
Could I just start by thanking the communities in some of the local government areas of concern that have elevated their vaccination coverage rates amazingly. What I'm trying to say to those communities is we are in some of those communities starting to see some glimmers of flattening. Now, as an epidemiologist, I do not want to call it too early, but I just want to give some hope that if you continue to stick the course, we may well see declining case numbers in some of those areas as we see vaccination rates climb. Now, in terms of local restrictions, if we're seeing an outbreak in a particular town, as the Deputy Premier said, there may be some particular strategies that we would put in place. If we note that, for instance, transmission is occurring in a particular being introduced in a particular way, we might actually work with those industries to up their COVID safety plans. We may actually work with people to recognise that there's an under-vaccinated group. So there may be some people in certain industries or certain professions where we know the vaccine coverage isn't very high or as high as we would like, and therefore we might work with them. So the public health measures may be geographical based, but they may be targeted. We may be supporting vulnerable communities, increasing access to vaccination. So a suite of strategies, and we will closely monitor.
Dr. Chan, if the statewide R factor remains above 1, will you still be comfortable with this reopening plan from mid-October?
So we're doing the modelling and we continue to redo the modelling. I think my answer to that question is the solution is in everyone's hands. I am so pleased to see the vaccine coverage tick over, and I think there was a question earlier around how will business know? It's publicly reported every day on the Commonwealth website. And so you can go there and track how many people were vaccinated, you can track the age distribution of who's getting vaccinated, and you can monitor closely our situation. What I'm hoping to see is that we have higher uptake, and I would actually be confident that probably by Monday or Tuesday we'll get to 80%. And what I'm challenging New South Wales residents to be is one of the most vaccinated in the world, because I know that the community of New South Wales believes in the science of vaccine and knows that it is our solution to reducing the harms associated with COVID. So I actually want to set the target for subsequent week. Wouldn't it be great if in 2 weeks' time I'm standing here and I've got 90% of the New South Wales community first dose vaccinated?
Just a couple of days ago.
Just confirm two things for the regions, or perhaps for the Deputy Premier. Can you confirm that schools will return to face-to-face teaching next week, even though there's 1 week left of term? And also, can people travel between regions that are coming out of lockdown? And do you encourage people to go from Wagga to Tamworth, or would you rather they stay in their LGAs?
Firstly, to answer the question, yes, schools will return, and they return to a level 3 COVID plan within schools, which means no extracurricular activities, no assemblies. There's a range of mask-wearing provisions. The Education Minister, Sarah Mitchell, has detailed that before, and we'll probably have more to say about that. So schools will return, even if it's just for 1 week. We know the benefit of kids returning to school. My message to the Regional Rural New South Wales is simple. It's like, if you don't have to travel, don't travel. And remember this, if you're in an area that's today been lifted from restrictions and from lockdown, and you enter an area that is in lockdown, those stay-home orders then apply to you when you return home. So for 14 days, those stay-home orders will apply. No different to if you come to Sydney now, those stay-home orders will apply. So my message to the regions is limit travel, limit mobility. We still have risk. There is no plan that has no risk. And what we've done is balance that with the work with health and Dr. Kerry Chan to give some regions relief and being able to lift them from Saturday onwards. But this is, again, as Dr. Chan has touched on, in the hands of people. If we do the wrong things, if we take this as an opportunity to go beyond the rules, what will happen is you'll see more communities put back into lockdown, and I don't want to see that. I don't want to see that on any community. It's been a tough 5 years in the regions, from bushfires to drought to floods, and of course managing COVID. So what I want to see is people doing the right thing and limit mobility as much as you can, because you're going to keep yourself open longer. Sorry, I'll just go one more here.
The regions that are coming out of lockdown, staying in lockdown, what's the threshold for them to come out? No cases for 14 days?
Yeah, look, we've set those parameters in place. It's about no cases, absolutely no cases in the community for 14 days. We look at sewage surveillance, we look at also exposure sites. They're all the thresholds that we've set with New South Wales Health that'll either put someone back into lockdown or have the opportunity for someone to come out. There are local government areas. There are only a single case, very limited community exposure, and we'll review that every week and see if there are opportunities for other regions. Today what we've been able to do is the bulk of opening the regions are based on sewage surveillance, of course our contact tracers, exposure sites, but most importantly COVID cases, and that is the threshold that we have set. Yep, sorry.
If the restrictions ease in South Coast and Braidwood, but the ACT is still going through its big outbreak, will Canberra still be allowed to travel to the South Coast of Braidwood? Or?
Well, firstly, the Queanbeyan-Pallarang, which is Braidwood, is still in lockdown. Restrictions remain because there are cases in the Queanbeyan-Pallarang local government area. Yes. The South Coast continues to be in lockdown. The Bega electorate's in lockdown. Eurobodalla is in lockdown. Goulburn's in lockdown. So the capital region remains in lockdown. But there are stay-home orders from the ACT. The ACT will make its next decision, I think, next week in relation to lifting its restrictions. But there are stay-home orders on the ACT for people to cross the border. They can't. So those limitations remain.
They still apply when the Queanbeyan-Pallarang and South Coast, they don't see cases for 14 days?
Yeah, so if, to your question, if Queanbeyan-Pallarang was to be lifted from restrictions, ACT have a level of restrictions that minimise movement from ACT residents coming into New South Wales.
These are still fairly significant restrictions that we're seeing at a 70% mark. The Premier says we'll need restrictions at 80%. There's probably a lot of people now wondering, are we ever going to see life as we saw it pre-COVID, and what has to happen for us to get back to the freedoms that we had prior to the pandemic?
I think everyone around the world watches the situation overseas, and I think we've been very honest that we have to learn to live with COVID. We are going to be vaccinated again. We're going to be potentially challenged by different variants. This will be a journey. We know that some flu seasons are severe, some flu seasons are mild. But the real hope is that we have safe and effective vaccines. We will have to learn how to live with COVID, and after years of cycling through this, we'll get to a level of comfort, a bit like we have with flu. But I can't stress enough that we will have to respond, and this is a cautious plan. As you highlight, we need to be cautious as we learn to live with this. And we also need to take in the fact that we're watching overseas, but we also are in a different position. And I would just want to urge everyone, vaccines work, vaccines are effective, and the higher the level of vaccination, and if we can deliver that to the most vulnerable of our communities in a very uniform way, we will be in a very strong position to go back to a life similar to what we had before. But will I always want people to be wearing masks if they're sick? Will I want them to be staying at home and not going to work? So there are many things from our experience with COVID that I think we've learnt about and will want to embrace even going forward.
Dr. Chan, just a couple of days ago you did raise the issue of 2 weeks for the vaccine to take effect, etc. So now you're not factoring that into this 70%? You don't want to wait for 2 weeks to pass before that 70% comes?
Well,
and a follow-up question as well, is it true that you did advise or push to Cabinet that you prefer an 85% rather than 70% as the threshold?
Look, let me just reframe. I'm really very excited by the way that the community is embracing immunisation. We'll get to 80% by Monday or Tuesday, and you can hold me to that, but please, the community members, can you keep coming forward so I can stick to that? I'm really confident that I do not think we are going to get vaccine hesitancy until a high level. I think people understand how significant COVID is and the fact that the vaccines are safe and effective and will embrace them. I'm very pleased that we've got access now to vaccination for our 12 to 15-year-olds, which will be coming on board around the middle of September, and access points through general practice. And we've also enabled our pharmacists to vaccinate 12-year-old down to 12-year-olds with the Moderna vaccine when that comes through. So the community will have the ability to get those 12 to 15-year-olds vaccinated, and so that all of that gives me a degree of confidence. But the community has to also do these next hard yards. This next hard yards of the 4 weeks is going to be tough. I know you've been in lockdown and you're starting to see the sunshine and those rays of hope. Please do not take risks while we're in this period. We do not need any super spreading events. We do not need any seeding in the regions. We just do not need anything else as we work to drive the case numbers down and leverage our response off the back of the vaccine uptake that we've seen.
Dr. Chen, can we just clarify? Dr. Chen, can we clarify the vaccination rules? It's really clear under the health orders. People who go to all these venues need to be vaccinated. What about the people who work in all these venues?
Yes. So all the people in these venues need to be vaccinated.
And how will they display it?
Well, the workplace will have some system of checking that, but this is very much.
Will exposure sites be put back in place, especially with reopening and people going back to pubs and stuff? Because our exposure sites still, will they be put back in place to be listed once we are reopening? Because they're not at the moment.
We will be looking at what contact tracing looks like in the New World Order. Yes, it will be pubs and clubs and other things if we have a positive case there. Our response may be different if we know that people are fully vaccinated. So we're working through a number of those issues, but we will have to reflect and learn. This is not going to be a set and forget. The learnings we've acquired now will be play into the way we write policies and practice in relation to close contacts and casual contacts, the period of time we require people to isolate for, the testing strategies. So to be honest with the community, we're going to have to work on a number of those things and redesign what our test, trace and isolate policies are into the future.
On the LGAs of concern. Currently, the case load in those areas, is that the kind of case load that you would suggest or you think would impose tighter restrictions when we do hit 70%, or are you comfortable with all of those LGAs coming out at the same time as everyone else at 70% double dose?
Look, I think that's a bit of a hypothetical question. What we're really focused on at the moment is increasing the vaccine coverage in those areas and seeing the case numbers decline. As I've indicated, we are seeing some stabilisation of case numbers in some of those areas, and what I'm hoping for is that we actually see those case numbers stabilise and then decline. That's the objective we're trying to achieve at this time.
Is the preference to get the effective reproductive rate below 1 before we get to 70%?
Clearly, I've articulated the fact that we're aiming to get the case numbers down,
But is the preference
and
to get the R rate below 1?
yes, that's what our aim is. We will not see declining case numbers if your R effective is above 1. As I said, this is all in everyone's hands. Please don't lose sight of the fact that for the next 4 weeks, we need to redouble our efforts and get vaccinated. There's still too many people in vulnerable groups that are not, in terms of medical comorbidities, people over 50 and people over 70 that are still not vaccinated. We still haven't got high enough two-dose vaccine coverage for some of those groups. And we've now got access to vaccine for the younger ones. And I've got to say, the uptake in the age groups that have just been recently had access to the vaccine is so reassuring to me, because I think that young people are acting so responsibly in terms of protecting themselves but protecting their loved ones.